Welcome back to the 180 System 21 question video series. Today we're going to be answering the question, is manual therapy bogus? There's been a lot of posts, especially on Instagram, either for or against manual therapy. And once again, we're kind of in between, but we're more on the anti-manual therapy stance. What we're going to talk about today is what conventional manual therapy does and why people use it, and why we would not support that kind of use for manual therapy. Now the question is, are we not supporting it because it's bogus, or are we not supporting it because it's contraindicated for what our patients need? So let's first answer the question, is manual therapy bogus? So when a physical therapist or chiropractor does manual therapy, or massage therapist gives somebody a massage, are they really not getting any physiological effects? We would say they're getting physiological effects, but those effects are detrimental to injury recovery and injury prevention, because most of those manual therapy techniques are causing damage to the tissue in order to cover up symptoms or increase range of motion, decrease muscle spasm, those kinds of things. So we've already talked about the progression to injury and what the root cause of symptoms is. The overwhelming majority of manual therapy that is out there does not attack the root cause of symptoms, which is why people have to keep on going back for it, because if anything, it's making them worse. Manual therapy is done to increase range of motion, some of it also to decrease pain, but let's take a look at some of these things. So manipulation, either chiropractic or physical therapy manipulation to put bones back in place, we would say that's bogus. If you look at the decades worth of work and research that's been done on that, we already know that that does not work. Mobilizations might increase acute joint range of motion. Do we use mobilizations? If we can't get a tight shoulder in position to test and treat, we might do mobilizations to get new acute range of motion, but then we follow that up and get to the root cause after that. Stretching, massage, Graston, do those things decrease pain? Sure, if your patient says they do. Do they increase short-term range of motion? Sure, but the question is, at the physiological base, what is going on to increase range of motion? Probably decreasing neuromuscular function, which would mean that this is not bogus, but it's contraindicated. Mulligan, Maitland, McKenzie, a lot of those manual therapy things that physical therapists use, do they work short term? Probably. Is it something that we would do? No. So if we look at what we do here at the 180 System with manual therapy, it's the opposite of what these thought processes are trying to do. So what we're trying to do is increase neuromuscular facilitation with the use of our hands. So anytime you put your hands on somebody, it's manual therapy. So that's why throwing everything into the manual therapy bucket and saying that all manual therapy is either bogus or contraindicated is not something that we would support. So what we will do in upcoming videos is actually show you what our manual therapy looks like, what it's actually doing, what the purpose of it is, and why we get the results that we get, not only acutely like these things get, but we get them long term. So if a patient comes back for a second visit, we expect them to be better than they were when they left us, and that's why we see patients for a minimal amount of time and they get fast, lasting results.